Bismillahirrahmanirrahim. Our today's topic is hypertension. इसको हम उर्दू में कहते हैं कि खून के दबाव का बढ़ जाना, इशारे खून. This is the most commonest disease all over the world, and this leads very serious issues. And one of the important issues is that it affects heart, brain, lower legs, kidneys, and other vital organs. So the objective of today's lecture is what is the definition of hypertension, number one. Number two, what is the pathophysiology of hypertension? And number three, what are the etiologies and risk factors of the hypertension? Number four, what are the organs on which the hypertension affects? And number five, what is the management of hypertension? So hypertension, not only in the Pakistan, but all over the world, it is most silent killer. So why we call the silent killer? Because it does not, because the patient do not know. The patient do not know what is happening. And when it affects, most of the things have gone from the hand of the patient. The patient usually in Pakistan presents very late. In Pakistan, patients, due to the lack of awareness, no doubt the healthcare system is very good in Pakistan, but due to lack of awareness, the patients do not care their own health most of the time. But in this COVID, a blessing is disguised that the COVID era has taught us a lot of things, and one of things is our health care. And everyone now in the Pakistan is considering their own self to contact the patient, contact the doctors in the hospital if he or she is suffering with a fever. Again, due to the dengue is another, I think, blessing in disguise. These two diseases are increasing the awareness of the patients and the public towards their own health. So first of all, we will define what is the hypertension. The hypertension is two component. One of the component is systolic, when the heart contracts and pushes the blood through the aorta, and the pressure of the aorta on this blood flow, how much it affects on this blood flow is called systolic blood pressure. And if it is 130 or more than 130, it is called hypertension. Another component of the heart, when it relaxes, the pressure of the heart, the pressure of the flow on the heart and the vessels is called diastolic pressure. And if it is 80 or more, if it is more than 80, it is called hypertension. When we were student, the limit of the hypertension was 140 by 90 millimeter of the mercury. But due to the new definition of American Heart Association, that 130 and cutoff and 80, 130 is considered at the hypertension. If we divide the hypertension is two types. One is the essential hypertension, another is the secondary hypertension. The essential hypertension means you do not know the underlying cause, but the mostly young patients or the middle-aged patients, they are suffering from the hypertension. They do not know. what is the underlying cause. And such patients comprise the 95% of the patients all over the world. And secondary hypertension is usually in the old age, and there are so many underlying causes of this damage of the different tissues, damage of the different organs leads to the secondary hypertension. So what is the pathophysiology of the primary hypertension? One of the important factors the students must know, because my today's lecture is only for my students and especially for the fourth year MBBS students of AJKMC Medical College, Muzaffarabad. And I promised with them that I will upload this my lecture when I will be free. So the one of the important pathogenesis is the release of the overactivity of the sympathetic nervous system. We have central nervous system, we have peripheral nervous system, and we have the sympathetic and parasympathetic nervous system. The overactivity of the sympathetic nervous system releases noradrenaline and adrenaline in certain peoples. They affects our 4 to 5 major organs in the body. When the important organ is the blood vessels, and then is the kidney, and other is the heart, then is the our skin, our GIT, our muscular system, and especially the cardiac muscle system. So one by one, we will discuss what will be the effect of the sympathetic overactivity when they affect on the blood vessels. Simply, this adrenaline and noradrenaline sympathetic overactivity will cause the vasoconstrictions. In the last slide, we learned that there are two components of the blood pressure. One is the systolic blood pressure when heart is contracting and pushing the blood in the arteries. And the second one was the diastolic pressure when the heart is relaxing and the blood is coming back to the heart. And so the pressure is, what is the pressure? So these two components, the blood pressure is product of two important things. One is the heart, one is the blood flow, cardiac volume, stroke volume, and second is the peripheral resistance in the blood vessels. So if I give you the example of the, suppose the river is flowing or the water is flowing in the canal, what will be the pressure of their banks on this flowing water? This will be called the pressure of this water. So same, the blood is flowing in the vessels, in our vessels. The pressure exerted by this on this flow is called blood pressure. Is called blood pressure. So if the water, keeping in view my example, the water flowing in the canal or flowing in the river, if you put some stones or if you close the banks on one side, you will feed the level of the water will start rising. One thing, or if there is a raining behind from where the water is coming, you will see the level of the surface of the water will increase due to increase in the blood pressure. Same is the principle in the blood pressure in the humans. If the volume is increased, the stroke volume will increase, the blood pressure will increase, the cardiac output will increase. If the peripheral resistance is increased, the blood pressure will increase. So the sympathetic nervous system, when it affects on the blood vessels, it causes the vasoconstriction. And when there is a vasoconstriction, there is increase in the total peripheral resistance. When there is increase in the total peripheral resistance, the blood pressure will increase. So the patient will suffer with the hypertension. Another second mechanism, second pathogenesis of pathophysiology is when there is overactivity of the sympathetic nervous system, They affect on a kidney, on the juxtaglomeruli, where there will increase in the renin. This will be converted in angiotensin 1, then angiotensin 1 to angiotensin 2, and then they will affect, and when the angiotensin 2 will increase, they will increase the hypertension. So in this mechanism, in this pathogenicity, if there is increase in the renin, angiotensin, aldosterone axis, I will discuss later on the what is the effect of the increase aldosterone on the blood pressure. In the second slide, in the next slide, I will let you know. The third, pathophysiology, when there is sympathetic overactivity, the heart rate will increase. When the heart rate will increase, there will be increase in the cardiac output. When the cardiac output will increase, there will be increase in the blood pressure. And the fourth thing is that when there is sympathetic overactivity, there will increase in the they will affect on the cardiac muscle. When they affect on the cardiac muscle, due to overactivity of sympathetic nervous system, there will be increase in the contractility of the cardiac muscle. When there increased contraction, there will be increase in the stroke volume. When there will increase in the stroke volume, there will be increase in the cardiac output, and there increase in the cardiac output, there will be increase in the blood pressure. So this was if there is increase in the sympathetic activities, sympathetic nervous system. Another mechanism is that in certain patients, there is some increase in the retention of the sodium, and decrease in sodium excretion system. The renin were increasing from the juxtaglomeruli. If there is defect in the cortex or in the juxtaglomeruli, the hypertension, patient will suffer in the hypertension. So if there is a problem in the tubular system and increase in the sodium retention, this will increase in the blood volume. When there is increase in the blood volume, there will increase in the cardiac output. When there increase cardiac output, there will be increase in blood pressures. The patient will suffer with the hypertension. In certain patients, there are no doubt renin, low in renin, but there is hypertension due to sodium, decrease in the sodium excretion. Sodium increases, increase in the sodium and increase in the blood volume in other way affect on the blood vessel, and the same when they affect on blood vessel. Similar effect you will see as we have discussed regarding the sympathetic and parasympathetic activity, overactivity of the sympathetic system. This will increase the peripheral resistance. And when there is increased peripheral resistance, there is increase in the blood pressure. So in these three slides, we have learned that blood pressure is of two types, systolic and diastolic. Number two, blood pressure increases, hypertension is, blood pressure is the product of cardiac output multiplied by the total peripheral resistance. If the cardiac output is increased, the blood pressure is increased. If the total peripheral resistance will increase, the blood pressure will increase. There are certain conditions in this which are called isolated hypertension, in which either the systolic blood pressure is increased or there is increase in the diastolic pressure. One other condition that is called the white coat hypertension. White coat hypertension means if you are at home and if you are quiet and calm and if you are relaxed or if you are sleeping, your blood pressure is normal. But when you are in office, when you are before the exam, when the students are in the labs, when the students are in the learning situation, when any person is in stressful condition, when any person is in feeling a lot of burden of the overwork, the blood pressure increase. But when same patients, same students, same person comes to their homes, their blood pressure is normal. So this is called white coat hypertension. So there are certain risk factors. Number two, as I discussed up to the definition. Number two was the pathogenesis. And number three, what are the different risk factors in such patients? The one of the important risk factors, if type 1 hypertension, if type 1 diabetes in the youngs and type 2 diabetes in the middle age people, that is the risk factor that increases the either the total peripheral resistance, diabetic nephropathy, or diabetic vasculitis, or other things, vessels, diabetic effect on the blood vessel increases the total peripheral resistance, that increases the. On one way, there is increase in sympathetic activity in a patient who is diabetes, that causes the hypertension. If such peoples who are prone to have a sympathetic overactivity, and if they are smoking, there is maximum chance of hypertension. And if alcohol, overactivity of the alcohol, that will definitely lead to the hypertension, and the hypertension will lead so many complications. One another type of the risk factor that in our people, in our public, in our these humans, there are certain type A personality. Type A personality are those people who always try to see perfection in each and everything. They are always in a hurry. They always in try to make everything positive. They think because we are positive and every person should be positive. Such persons are called type type A personality, and these personality are not usually suffering from the hypertension. They have overactivity of their stomach. They can suffer with the diarrhea. They can suffer with the hypersensitivity of the skin, and so many such peoples are usually they looks more aggressive even sometimes. इन लोगों को गुस्सा ज्यादा आता है. So that is another thing that you type 1 type type A personality usually have over some activity of the synthetic nervous system, and they lead to the hypertension. Another risk factor is the vitamin deficiency, our dietary deficiency, our diet imbalance. This leads to the hypertensions. And if a patient is suffering with sympathetic overactivity and have the deficiency of vitamin, that leads to hypertension. Obesity is another risk factor for such patients. Stress and lack of rest, these people leads to these are the predisposing factor in patients who are suffering from the essential hypertension or the primary hypertension. So my advice to the students, if your parents are suffering with hypertension, you are prone to become hypertension, and you should be very careful to control these 6-7 risk factors so that you may not suffer with the hypertension. And if you cannot control these things, another thing is that you start a good exercise, you start a good diet, you can take it. I will discuss in the management of this one. So another, this was about the essential hypertension. This essential hypertension is about 95% of the people of the hypertensions. Now the causes of secondary hypertension, lot of causes, and one of the important causes is the renal damage. If I go back, this is the kidney. Kidney has this central structures, this is cortex, this is the medulla. And otherwise, this is the parenchyma. If this damage is in the parenchyma, the patient will lead to certain diseases of the kidney, and the patient will lead towards the hypertension. This is the tubular system. If there is a problem in the tubular system, the patient will definitely lead to the hypertension. And the third component is the vascular supply to the kidney. And if there is atherosclerosis of the renal vessels, or uh, if there is any problem if there is in coarctation, or if there is aneurysm, or if there is any problem in the renal artery, the patient will definitely lead to the hypertension. So one of the renal damage in the parenchyma is glomerulonephritis, nephrotic syndrome, nephritic syndrome. These are the condition in which all glomerulonephritis mostly lead to the hypertension. And the second one is the diabetic nephropathy. Diabetes is the most not only killer, it leads heart attack, it also predisposes the damage, leads to the hypertension, secondary hypertension in the old ages. And type 2 in such patient, type 2 diabetes is very important. Certain people have polycystic disease, and this polycystic disease, not only in the children, also lead to the and as I told you, renal artery stenosis, atherosclerosis, aneurysmal, or any other problem is there that leads to the hypertension. If there vascular dysplasia, fibromuscular dysplasia of the renal artery, or if there is a vasculitis of the renal artery, that leads to the so the important damage in the renal tissue with so many causes starting from the parenchyma to the tubular system to the vascular system lead to the hypertension. So the physician must know before treating the patient either the patient is suffering from the essential hypertension or secondary hypertension due to renal tissue damage. Another important cause of the secondary renal tissue is called secondary hypertension is called endocrine diseases. So many endocrine diseases in that one of them is the aldosteronism. Aldosterone increases in certain areas as we have discussed in essential hypertension. If there is increase in aldosterone, they will lead to the sodium retention, that will lead to the increase in the blood volume, that will lead to the cardiac output, that will lead to the hypertension and the blood increase in the blood pressure. This such one of this condition is called Kahn syndrome. Another one is if there is a problem in the cortex, in the adrenal medulla, in the adrenal. If you cut the adrenal glands are present on top of the kidneys, on both kidneys. They have cortex, and the cortex is divided into 3 zones, and then is the medulla. If there is a problem in zone 1, peripheral zone, that is the patients, they lead to the Kahn syndrome or increase in the aldosterone. If there is a problem in zone of fasciculata and zone other area, that leads to the Cushing syndrome. Cortisol level is increased. When the cortisol level is increased, there is increase in the that is increase in the cortisol level, and in such a patient there is no increase in the sympathetic activity, but the sensitivity of the sympathetic activity is increased, and that will eventually leads to the hypertension. All the mechanism we have discussed in essential hypertension. Another condition in the children, if there is pheochromocytoma, this is the disease of the medullary area of the adrenal cortex, and usually patients, this is also called 10% patients, 10% tumor. So this is usually in the children. The treatment is removal of the pheochromocytoma. This was about the diseases of the adrenal gland. Another endocrine is important. Endocrine is our thyroid and parathyroid. If there is hyperparathyroidism, low FSH, TSH, and increase in the T3 and T4, that lead to the increased sensitivity of the sympathetic activity. And another way, when there is increase in sympathetic activity, that leads to the hypertension. Even it has a lot of other effects on our muscles and other our system that leads to hypertension. But important thing is that if there is increase in such patient, there is increase in the sympathetic sensitivity. We have seen that in certain condition, in certain patients, they are not suffering with the increase in the T3 and T4. They are not hyperthyroid. There are euthyroid or hypothyroid, but there is sodium retention and that increase in the diastolic pressure. Such patients are called isolated type of blood pressure. Another third important endocrine disease is called increased parathyroid hormone level. This causes imbalance in the calcium, and that leads to the vasoconstriction, that leads to the total peripheral resistance, that leads to the blood pressure and high blood pressure. This was some endogenous effect on our endocrine systems. There may be certain exogenous effect of the pills or tablets or steroids patients are taking. They lead to the exogenous hormone, exogenous steroid system that lead to the hypertension. Oral contraceptives and glucocorticoids are important predisposing factors that lead to the secondary hypertension. There are so many miscellaneous types of the causes that the patients suffer with hypertension. One of them is the coarctation effect, aorta. If there is coarctation of the effect, the peripheral area in the blood pressure develops in the peripheral area before the coarctation, and that pushes the blood with more force in the patient. Sometimes the patients may have systolic blood pressure. Another is systolic hypertension. Another is the high intracranial pressure that leads to. There are so many mechanisms which are involved in the intracranial pressure. Very simply, students know that high intracranial pressure leads to the hypertension. In pregnancy, preeclampsia, proteinuria, high blood pressure, eclampsia, when there is fits, there's very dangerous condition. The gynecologist should be very careful in maintaining the pregnancy. Otherwise, there are chances of the abortions. As I discussed, exogenous factor, as I discussed in previous slides, the dexamethasones, oral contraceptives, cocaines, and so many other drugs. So my advice to the students and the patients that when you are going to take any drugs, please read the prescriptions written on this, on the brochure provided in the tablet or in the syrup. So if if you are hypertensive and any drug you are taking is contraindicated, you should contact your physicians. The last, not the least cause is the serotonin syndrome. So many serotonin syndrome, allergic syndrome that may lead to the hypertension. One of my physician was telling me that, Dr. Bukhari, please be careful when you are taking anti-allergy drugs. Even certain anti-allergy drug will cause the vasoconstriction, and that will increase your total peripheral resistance. That may lead to the hypertension. So these were the certain predisposing factor of the secondary hypertension. So in the third component, we have covered the pathophysiology of our essential hypertension, the pathophysiology and different etiologies of our secondary hypertension. So the classification of the blood pressure. So normal range, this is the latest criteria of American Association of Heart Disease. So the systolic blood pressure must be 120 or less than 120 millimeter of mercury, and the diastolic blood pressure less than 80 millimeter of mercury. When it is elevated, it is normal but elevated. Or in other words, the pre-hypertensive 120 to 129 roundabout, if you add plus 9 in the systolic area, or if you lead to the 80 millimeter of mercury, this is the called pre-hypertensive. So you should every month go to your physician and ask them to please check our hypertension, check our blood pressure. So you should be very careful in the beginning. If you are careful in the beginning, you can save your heart. The hypertension is divided into two stages, the stage 1 and the stage 2. In stage 2, if you add another 9, 139, if you want 130 to 139, and if you add 9 in your 80 on both sides, 9 millimeter of mercury on both sides, it is called stage 1. It is also dangerous. So the cutoff level that usually I will advise to my students is 85. If it is more than 85, it is stage in diastolic millimeter of mercury. It is the patient is suffering from stage 1 diseases. No doubt the stage 1 disease are safer, but later on leads to the cardiac hypertrophy, and cardiac hypertrophy may lead to the other complication that we will discuss in the fourth component. The stage 2, when it is more than 140 and more than 90. So in the summary of this slide is that the range 120 to 130 is normal. If it is above this, 140, if it is above 140 and another above 90, it is patient is suffering with a stage 2 hypertension. How much Pakistani peoples are suffering with hypertension? Adults, as I told you, are suffering with essential hypertension, and all primary and population are 220 million Pakistani. 18% are suffering with this hypertension, and every third hypertensive age 40 year and above was susceptible to the extensive range of the diseases. So very common disease in the Pakistan, those should be very careful. The people should not take the smokes, should be avoid the alcohol, should avoid the stress, should control their blood diabetes. Who are at risk? Advancing age, we cannot control the advanced age, but we can, if we want to live healthy, we should adopt certain criteria, certain lifestyles we should adopt. We should change our lifestyle if you want to remain healthy, if you want to keep our heart healthy. So the advanced age is another factor. Sex, the males are more prone for the hypertension because the testosterone in the males are predisposing factor in the hypertension, while the female hormones they are friendly and they save them before menopause. But after menopause, the estrogen level and other levels are decreased in the females, and they almost equally they suffer with the hypertension. But if we compare, males are more face to the hypertensions. Family history, if your family is suffering with hypertension, definitely your children will suffer with the hypertension. This is genetic predisposing, mostly essential hypertension. Sedentary lifestyle, बैठ के काम करना सारा दिन, कुर्सी पे बैठना सारा दिन, शॉप पे बैठना सारा दिन, एक जगह पे बैठना, साइकोलॉजिकल Psychosociological stress is very important. सोना कम, नींद कम करना, ज़हनी परेशानी लेना. These are the two important factors that lead to the hypertension. जल्दी पे पेट्रोल डालना, smoking, high cholesterol diet, low fruit consumption, low vegetables, low fresh vegetables containing vitamin C and other antioxidants. This lead to the hypertension. These are the predisposing factors. Obesity, weight gain, and other disease that lead to the hypertension, coexistent disorders such as diabetes, hyperlipidemia, high intake of alcohol. These are the predisposing factors that have hypertension. You should be careful if you have family history of heart attack and blood pressure. If you are young, you should see what are the factors which increase your cardiac output. But in elderly, you should be very careful because what are the factors which are increasing your atherosclerosis, diabetes, smoking, hyperlipidemia, hypercholesterolemia, atherosclerosis. These two factors should be very careful. Why to treat and how to treat? Because the hypertension can damage to each and every system of the body. But let us see the most important, the most commonest cause of the disease, of the death is coronary heart disease. And coronary heart disease, the important cause of the coronary heart disease is the hypertension. So if you are suffering with the hypertension, you have chance to develop the coronary heart disease. And if the coronary heart disease, definitely there are chances of myocardial infarction. आज नहीं तो कल अगर आपने coronary आज ब्लड प्रेशर को कंट्रोल ना किया तो हार्ट अटैक से मरने के चांसेस ज्यादा हो जाते हैं. Another important thing is the brain. Another organ important, दिमाग हमारा, brain. The patient, you can face to the stroke, hemiplegia, paraplegia, so many things. Blood pressure, there is a rupture of the there is a rupture of the cerebral hemorrhage that leads to the damage of that area, and that cause hemiplegia or paraplegia. So many hypertensive encephalopathy is another a disease that can affect on our brain. Two major organs, heart and the brain. And the third one is our kidney. Kidney diseases may lead to hypertension, and hypertension may damage to the kidney. This is the bilateral phenomena that cause the blindness, that cause your retinopathy, that can cause your aortic aneurysm, that can cause left ventricular hypertrophy, heart failure, similar things. In extremity, that leads to the gangrene and of the lower extremity. And one important thing is the stroke. To avoid the stroke, if you control the blood pressure, if you control your stress, if you control your smoking, if you control your diabetes, you can control your stroke. This is up to you. आपने खुद बचना है अपने आप के, आपके अपनी सेहत आपके हाथ में. आज जागें ताकि कल के नुकसानात से हम बच सकें. Another is the pregnant lady, as we have discussed, eclampsia and preeclampsia. So what are the target? I discussed the heart, the brain, the kidney, the peripheral nerve, and the retinopathy. Heart is more on the risk. How to diagnose? Very simply, as I told you in the beginning, this is the fourth component. This is the fifth final component of our today's lecture, how to manage, why to manage, because the patient do not have mix up clinical manifestation. A physician can easily describe. There are so many, most of the patients are asymptomatic. And this is very dangerous. The patient is suffering with a silent killer. The patient is, this blood hypertension is a silent killer. because there is no specific complaint and manifestation other than the elevated systolic and blood pressure. And if you do not go to a doctor for the checkup your hypertension, that will lead to your crisis. Morning occupational, some people feel the headache in the that's on the temporal side of the pain, or sometime in the occipital side of the pain. Dizziness, fatigue, may in some patient blurred visions, and epistaxis when there is severe hypertension. So there is, in my opinion, there is no, most of the people are asymptomatic. Or self measurement of the blood pressure, you should have a, there are so many instruments. One is the electronic instrument, that is you can keep in your auto measure. There are so many devices available in the bazaar. One is the called the electronic devices you keep here on your wrist, and there is a button, you will push the button. But very important thing, when you are going to check your blood pressure, or when you are going to the clinic for checking of the blood pressure, very important thing is you should not be in the stress. One, and you should be relaxed. If once in a one reading you see that the blood pressure is increased, you take another reading, or you take in the 24 hours reading in the evening or at night. So one device is electronic device. Another is certain Chinese cuff, and this is the cuff and the meter. And third one is very important, that is the mercury. The hypertensive machine with the mercury. You will see, you will push it, the mercury, when you will inflate, you will see the rising of the mercury level. So important thing is that when you put this heart, this arm in the level of the heart, you sit in this position as I am sitting. This your leg should be in this position, 90 position should be on the surface, and you put this level here, and the cuff should be 80% of your arm, from here to here, elbow to here, your arm. This whole length, your cuff should be 80% of this one. And this technique is very important. So the doctor should know, because there are so many factors, your position, your device, there may be error in the device, or the person who is taking your blood pressure is not trained. So this is the position, sitting on the chair. This is the doctor. This patient seated quietly for at least 5 minutes in the chair with feet on the floor and arms supported at heart level, as I gave the demonstration. And approximately, as I told you, cuff, bladder, and circle at 80% of your arm, and take two measurements. But my advice is that one, you see that your blood pressure is in high level, you also check in the 24 hour in the evening. You should maintain daily record and monthly go to your doctors, and as we have systolic blood pressure is the point at which the first of two or more sounds are here. Systolic pressure is the point of disappearance of the sound. That is called Crocroff's fifth sign. So these are the how to measure, how to diagnose. The only diagnostic tool is to test the blood pressure with your device. Ambulatory blood pressure monitoring inform about DB pressure, as you told you during your daily activity, and that is and ambulatory in 24 hours and when you are sleeping, and you take the average of this one. Correlate better than the office measurement with target organ injuries. That is very important, this one. As we discussed that in secondary or the primary hypertension, you should evaluate your different organs. You should check your heart by ECG. You should check your kidney by urine analysis. You should check your by protein and something else, protein urea, something else. You should check the patient blood glucose, electrolytes, potassium, creatinine, urea, GFR and calcium level. You should check the vitamin D level, lipid profile, fasting lipid profile around about 10 to 20, 10 to 12 hour fasting of the lipid profiles, whole lipid profile, not only the cholesterol, and albumin and liver function test. And so the tests, these are very important to know about the cause of the blood pressure. So mostly we have covered our topic, but just I will not discuss the medicine area, but how to treat. There are two methods of the ट्रीटमेंट कि ब्लड प्रेशर को कैसे कंट्रोल करना है. पहला तो ये है कि उसको चेक करना है. चेक योर ब्लड प्रेशर एंड contact your cardiologist, contact your family physicians. The family physician will advise you before advising your drug, advise certain change on your lifestyle. Lifestyle is very important to save your heart. अगर आज दिल को बचाना चाहते हैं, आप उन अमवात में अपना नाम नहीं लिखवाना चाहते. वैसे तो अल्लाह ताला के हाथ में है कि हमारी मौत किस तरह होती है, लेकिन सबसे ज़्यादा जो अमवात हो रही हैं वो हार्ट अटैक से होती हैं. और हार्ट अटैक से बचने का तरीका ये है, आप उम्र को कंट्रोल नहीं कर सकते, आप अपनी जेंडर को तब्दील नहीं कर सकते, आप दूसरे, लेकिन आप रिस्क फैक्टर को तो कंट्रोल कर सकते हैं. जो मैंने 6 से 7 रिस्क फैक्टर गिनाए, और उनमें से सबसे इंपॉर्टेंट चीज़ है लाइफस्टाइल को चेंज करना. तो few things, my last few words about the blood pressure, how to treat the patients. One is the, as I told you, your lifestyle, and other is your, देखें आपने अपने लाइफस्टाइल को चेंज करें. नंबर 2 ये है कि आपने अपने फिजिशियन के पास जाना है. आपने अपना सिर्फ दवाई लेके वापस नहीं आ जानी. यू शुड हैव रेगुलर चेकअप विद योर कार्डियोलॉजिस्ट, with monitoring of your ECG, with monitoring of your other laboratory test, and your regular record of the blood pressures. So these are the levels that that we have discussed in the detail. The goal of the therapy. Now the dash ड्रग. आपने ड्रग को किस तरीके से, अपनी ड्रग को, आपको अपनी डाइट को कैसे, कौन सी, which diet you have to take. वक्त के साथ साथ with the passage of time reduce the amount of foods you are taking, the times of the foods you are taking. Do not take food when you are sleeping at night. There should be, in my observation, I may be wrong, लेकिन मैं गलत हो सकता हूँ, लेकिन मैं as a doctor, as a consult, as a pathologist, as a researcher कह सकता हूँ, रात को सोने से पहले कम से कम 4 घंटे खाना खाएं. क्या आप ऐसा कर लेंगे, मॉर्निंग के बाद आप लंच करें और फिर रात को खाना ना खाएं, फ्रूट ले लें, या रात का खाना आप खाते हैं तो उसके साथ आप दोपहर को फ्रूट ले लें. और रात को सोने से पहले अगर आपने रात को 10, if you are going to sleep at 10 o'clock or 12 o'clock, you should take your dinner before 8 p.m. So डाइट कंपोनेंट इज वेरी इंपॉर्टेंट। हदीस रसूल है कि मुसलमान वो है कि जो उस वक्त खाता है, बिस्मिल्लाह पढ़ के खाता है, उस वक्त खाता है जब उसको भूख लगती है, और अभी अभी भूख बंद बाकी रहती है तो अपना खाने को बंद कर देता है। दीज आल मैसेजेस आर टू कंट्रोल योर हेल्थ, कंट्रोल योर important thing. The other thing is the exercise. 30 minutes brisk walks, minimum 4 days. If you cannot keep this 7 days, no, nowadays the you people are very busy. But 30 minutes brisk walk. What you mean the brisk walk? Slow walk, no effect. 1 घंटा भी चल लेना आप स्लो वॉक, कुछ नहीं फायदा होता until unless your heart beats and respiration increases. Suppose if your normal heart rate is 90, brisk walk, in brisk walk your heart rate should be increased in 100 and so much. So 30 minutes average, you can walk 40 minutes, 1 hour, but should be regular exercise. You can even namaz is a good exercise. नमाज इज ए गुड एक्सरसाइज। हम रुकू करते हैं, सजदा करते हैं, तहज्जुद करते हैं, तो हमें कोरोना से बचाने का एक फैक्टर ये भी है, जब हम 5 वक्त की नमाज पढ़ते थे तो हम सफाई का ख्याल हो जाता था, हमारे हाथ धुलते थे। तो दीज आर द थिंग्स दैट इज व्हाई इन पाकिस्तान कोरोना का इफेक्ट कम रहा ऑल ओवर द वर्ल्ड। सो एक्सरसाइज एंड देन इज द अगेन इफ यू आर ओवरवेट, डिक्रीज द वेट, कंट्रोल योर ओबेसिटी, रिड्यूस द साल्ट। नमक बहुत खतरनाक है। 2 थिंग्स आर वेरी किलर especially after 40, sugar, white sugar and the white salt. आप देखें साल्ट अगर आप पूरी फैमिली 1 चम्मच खाती है तो आधा कर दें, बिल्कुल नहीं खत्म करना, reduce the 50% of the salt, because sodium also required needed to your for your normal activity, for your muscles and for your cardiac contraction and for other things. ये खत्म नहीं करना इसको। Same as the sugar, reduce the sugar, especially reduce the पहले ऐसा होता है बिल्कुल बहुत ज्यादा शुगर लेते हैं जवानी में और फिर आपने बिल्कुल खत्म कर देना। ऐसे कंट्रोल, एवरीथिंग शुड बी कंट्रोल, अवॉइड हार्मफुल हैबिट्स, स्मोकिंग, अल्कोहल, और जो आजकल अद्वियात आती हैं, so these heroin, cocaine, all these things you should avoid. So lifestyle is very important to lose the weight if overnight, increase physical activity, reduce salt intake, stop smoking, limit intake of the food rich especially fat, and take the fresh vegetable, fresh fruits, and limit the alcohol. This is the chart। ये बता रहा है कि आपने अगर 30 मिनट्स डेली वॉक करते हैं तो उससे कितना आपका ब्लड प्रेशर नॉर्मल होता है। वेट रिडक्शन से 5 से 20 मिलीमीटर ऑफ मरकरी आपका ब्लड प्रेशर कम हो जाता है। और आपकी डाइट से 8 से 14 मिलीमीटर ऑफ यू कैन रिड्यूस योर ब्लड प्रेशर। डाइटरी सोडियम इनटेक से 2 to 8 मिलीमीटर आप ब्लड प्रेशर कम कर सकते हैं। और वन ऑफ माय फ्रेंड इज फिजिशियन, ही टोल्ड मी दैट बुखारी साहब, if you reduce the 2 millimeter of mercury, you reduce the 10% chances of heart attack. 2 millimeter of mercury आप ब्लड प्रेशर कंट्रोल कर लें, 10% आपके मायोकार्डियल इंफार्क्शन कम हो जाता है चांसेस। The physical activity, 30 minutes brisk walk, any type of the brisk walk or any exercise, or a moderate reduce alcohol. As a Muslim, the alcohol is prohibited, so reduce all these things. This is the good diet. This is the maximum you take, this is the minimum you take, then reduce in this way. The salt, reduce the salt. So the certain drugs, physician, diuretics, beta blocker, calcium intakes, and ACE inhibitors, angiotensins, your cardiologist can. I am a pathologist, I cannot advise you about this. So your cardiologist after complete investigation, can advise you the which drug you have to take for yourself, because each drug is not for every all person, because every person has its own pathophysiology of the hypertension. So at the end of this lecture, my message: reduce your hypertension, reduce your uh, chances of myocardial infarction and stroke, change your lifestyle, change your sleeping hours, and control your stress, control your worries. If you are typic personality, if you are diabetic, if you're a smoker, and if you have family history, you should control all these things. Thank you very much. And now, one of the question is that lifestyle intervention for the management of the hypertension includes all. So A, regular aerobic activity of the 30 minutes per day, salt intake reduced to 6 millimeter per day, attain a and maintain the BMI 20, more than 25 K per square millimeter, diuretics in fruits, so and the moderate. So only the answer is C. Another MCQ questions: hypertension measurement help in prevention of all except I have given the deep venous thrombosis. So at the third questions, isolated systolic hypertension is common in young, elderly. Isolated, as you told you, you have only systolic blood pressure and normal diastolic pressure. So this is more common in the blacks. Another example is antihypertensive agents reduced for protection of the cardiovascular disease, calcium channel blocker, diuretics, ACE2 inhibitors, alpha antagonist, and central nervous system. Another MCQ question is angiotensin receptors blockers play renoprotective effect through all except. You should go through the pharmacology and the drugs, and then you will find the beautiful answer. This is the sixth question: which of the following the side effect of the inhibitor, especially hyperkalemia, hypercalcemia, hypergynecomastia, hypertension, hypermagnesemia? Very important. You all read the side effect of the ACE2 inhibitors, and then you will find the proper answer. This is the sixth question, MCQ question. Calcium channel blocker cause all except pedal edema, just like this one, edema, flushing, hyperkalemia, and headache. You read the calcium channel blockers side effects, and you will find out the answer among this one. Eighth MCQ, safest drug for the hypertension in the pregnancy. Very, very important. ACE2 inhibitors, angiotensin receptor, diuretics, and methyl dopa. Go on the pregnancy, patient with pregnancy, and what are the safest drug among them, and find the answer. This is the ninth questions. The first line of antihypertensive and diabetes, diabetic nala. That is why I gave you the message that your cardiologist will select the drug. You should not go to the general physician. You should not go to the quacks. You should not start your home remedies. एक से सुन लिया, दूसरे से सुन लिया. No, 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 no. Heart is very precious. You should go to the cardiologist. After the all investigation, your cardiologist will advise which drug is safest for you. So this is the 10th question. Which of the following antihypertensive agent is relatively contraindicated in congestive cardiac failure? ACE2 inhibitor, angiotensin receptor blockers, beta blockers, diuretic. So diuretic is this very important, this one. Thank you very much. This was all message for you. Hope all my students will uh, listen my lecture, and at the end I have given the exercise. You will open the books and you will get the answer. You can reply under my uh, question answers on my channel, and hopefully I will give you the response. Thank you very much. Allah Ta'ala aapka hami o nasir. Thank you very much, and congratulations to the whole Muslim, because this is the holy month of arrival of our lovely holy prophet Hazrat Muhammad sallallahu alaihi wasallam. May Allah bless you. May Allah keep you safer from all diseases. Bihaqqi Muhammad wa ali Muhammad. Allahumma salli ala Muhammadin wa ali Muhammad. Kama sallaita ala Ibrahim wa ala ali Ibrahim innaka Hamidum Majid. Allahumma barik ala Muhammadin wa ala ali Muhammad. Kama barakta ala Ibrahim wa ala ali Ibrahim innaka Hamidum Majid. Assalamu alaikum wa rahmatullahi wa barakatuh.